Mr. Speaker, I rise in support of H.R. 7105 as amended, the Johnny Isakson and David P. Rowe, M.D., Veterans Health Care and Benefits Improvement Act of 2020. H.R. 7105 was introduced by Representative Mike Levin, Chairman of the Subcommittee on Economic Opportunity, and the bill before us today contains several crucial improvements that will better the lives of veterans during the COVID-19 pandemic and beyond. The first title of this bill contains legislation from Representatives Levin, Underwood, Sablon, Brownlee, Wexton, and Lee to improve the Forever GI Bill. These provisions will ensure that institutions of higher learning are more accountable to student veterans. These provisions will improve oversight of colleges and universities, provide more flexibility for veterans to use their benefits, and improve information sharing with students so that they can make a more informed decision on where to continue their education. Further, building off my Student Veterans Coronavirus Response Act from earlier in the year, this legislation includes immediate COVID-19 related relief from Representative Cunningham to student veterans. His legislation will extend housing benefits to student veterans, provide more flexibility when using their education benefits during the pandemic, and modernize apprenticeship programs to allow them to continue effectively during COVID-19. Mr. Speaker, to better serve those veterans who are experiencing homelessness, this legislation includes contributions from Representatives Panetta, Peters, Wild, Beatty, and Brownlee to provide more veterans with access to the HUD-BASH program, including veterans with children and women veterans, and provide legal services to homeless veterans. Recognition of service and sacrifice is a priority of mine, and I thank Representative Cox for his bill that awards benefits to military advisors who served in Vietnam immediately prior to the Vietnam War. This group of advisors faced hostilities in the years preceding the formal declaration of war in Vietnam, and some lost their lives. The Military Assistance Advisory Group will now have greater access to certain wartime benefits. Mr. Speaker, similarly, this legislation expands benefits for certain veterans, including Medal of Honor recipients. Thanks to Representative Lamb's legislation, those veterans and their survivors will now receive a greater amount of special pension. My priority next Congress is to bring more veterans with toxic exposures into VA and create an easier process to get these veterans benefits. One group I've heard a lot about is K-2 veterans who served at Karshi Khanabad Air Base in Uzbekistan. These service members slept in tents above soil that glowed and oozed, and unsurprisingly, many later fell ill. I fully support inclusion of legislation that partners with the Centers for Disease Control to study these exposures and resulting health effects. For veterans who have passed away, burial benefits ease the burden on grieving families. This legislative package expands these benefits, creating greater access. Representative Delgado's legislation makes counties eligible for VA grants to build and operate veteran cemeteries, bringing a veteran's final resting place closer to home for rural communities. Representative Sablon's legislation works to expand those grants, which are also available to states, territories, and tribal governments to cover increasing costs of cemetery operations. This legislative package includes several provisions from numerous healthcare-related bills, and I'd like to just take a minute to highlight a few. I'm really delighted we are able to include Representative Gallego's Native American PACT Act, which prohibits VA from collecting co-pays from a veteran who is a member of an Indian tribe. Mr. Speaker, H.R. 7105, as amended, also includes innovative ideas like Representative Capter's the VET HP Act, which seeks to expose undergraduate students, considering careers in medicine to directly experience VA's healthcare environment. In addition, this package includes language requiring state veterans' homes to provide VA with reoccurring reports on COVID-19 cases and related issues in the facility. This is one more way that VA and Congress can ensure veterans in state veterans' homes have the resources they need during this public health emergency. Mr. Speaker, I am especially pleased this end-of-year package includes the Deborah Sampson Act, introduced by Representative Julia Brownlee, the chairwoman of the Veterans Affairs Health Subcommittee. Title V is named after Deborah Sampson, a Revolutionary War veteran from Massachusetts, who served in the Continental Army for 17 months and was wounded in battle more than once. Mr. Speaker, Deborah Sampson was neither the first nor the only woman to serve in the Continental Army, nor was she the first woman to be granted a pension by Congress, but she was the most persistent. Over 38 years, Congress granted her a pension, back pay, and ultimately her husband was granted a survivor's pension after her death. It is because of similar persistence by women warriors who followed in Deborah Sampson's footsteps that we are considering this legislation today. Among the numerous provisions included in this legislation, perhaps the most important relate to eliminating sexual harassment and assault. Today, nearly 1 in 4 new recruits joining the military is a woman. And as a result, women veterans are the fastest growing demographic in the veterans community, and they must be prepared to welcome them. Unacceptably, at least 1 in 4 women veterans experience sexual and gender harassment at VA facilities. This must end. Mr. Speaker, last week, both the VA OIG and the Fort Hood Independent Review Committee issued reports that emphasized the need to do more to address the toxic culture that exists at the Department of Defense and at VA. No veteran, caregiver, employee, contractor, or other public visitor should experience sexual harassment or assault at VA. H.R. 7105, as amended, requires VA to develop a comprehensive policy that includes bystander intervention, mandatory reporting mechanisms for employees, confidential reporting mechanisms for veterans, and holds leadership accountable for addressing sexual harassment and assault at VA facilities. This bill also includes provisions put forward by Representative Pappas that requires new rules for how VA collects debts owed by beneficiaries to avoid unnecessary harm to veteran credit ratings, as well as to prevent many overpayments from happening due to eligibility changes. Now, finally, Mr. Speaker, the bill before us improves the protections offered by the Service Members Civil Relief Act for veterans and their families. The included legislation from Representatives Bustos and Rose provides additional protections to ensure that veterans aren't disadvantaged by their service to our nation, and that they are allowed more flexibility and protections for their employment and leases. Mr. Speaker, I urge all members to support H.R. 7105 as amended, and I reserve the balance of my time.